Hello, hepatitis elimination friends. Speaking to you from Aotearoa, New Zealand. We're the first country in the world to see World Hep Day. Happy World Hep Day. It's a happy day for us. We've been working with NUE, the people and health system on NUE to help get them over the line as the first country to fully screen their population, connect them to care, eliminate viral hepatitis. Hep can't wait. We're not waiting. We're looking towards our next country. Have a great day.
Hep can't wait. What's that date? July 28. Take action, get satisfaction, get cured. Rest assured, in SA we know the way. Visit our website, day or night. Take the quiz, you'll be a whiz. Enjoy the surprises, you might win prizes. World Hepatitis Day 2021 can be fun.
It's World Hepatitis Day and I'm Carrie from Hepatitis Australia. I'm on the lands of the Ngunnawal people, the First Nations people of Canberra. COVID-19 has significantly interrupted Australia's hepatitis response. For example, last year, 200,000 fewer Australians received a hepatitis test. But with a concerted and united effort, we can turn that around and we can meet our national targets. Strong investment now will save lives and money. Australia can't wait to eliminate hepatitis.
Hi, my name is Jackie from Taiwan Hepatitis Information and Care Association, or SICA. Viral hepatitis is one of the leading causes of liver cirrhosis and liver cancer. Therefore, we can't wait for elimination of viral hepatitis. At SICA, we provide support, share information, and link patients to care. We conduct education series on social media, answer questions, and raise awareness for viral hepatitis. We also advocate for the rights of hepatitis patients to be treated equally, and we will continue to make every day our World Hepatitis Day.
I'm now on the way to see my friend Mr. Pan. He was kicked out of the factory because of a person living with hepatitis. And now he's in the late stage of liver cancer because of poverty, because of lack of treatment. He can't wait. I can't wait. The community can't wait, especially the hepatitis can't wait. Alright, I think it's time for me to catch a bus. But please join us, the World Hepatitis Day initiative. It's time for a change.
Today is World Hepatitis Day. My name is Patrick Sabunit, President of Yellow Warrior Society Philippines. We aim to eradicate viral hepatitis by 2030. This is only possible to expand our viral hepatitis program to the other cities, especially those areas with high endemicity and those geographically isolated and disadvantaged area. Local government unit must find ways to allocate their manpower and funds to combat viral hepatitis. We cannot let COVID-19 get in the way. This is time for the government to invest viral hepatitis. Get tested, get treated, get vaccinated. Hep can't wait.
Hello, we are Budi Lokmanto Foundation from Jakarta, Indonesia. Because of coronavirus pandemic, all of our activities are being postponed. Currently, together with the kids from boarding school and orphanage, we are happy to deliver news that the kids have been free from hepatitis B virus because of the immunization we had provided before. Hopefully, we can still take a part in eliminating hepatitis B virus in 2030 after coronavirus pandemic. Thank you. Bye.
Ladies and gentlemen, congratulations for World Hepatitis Day. My name is Jim Mo-yang, printer of Basel. As you know, World Hepatitis Day started at 2008 annually and one of 11 official global public health campaigns marked by the WHO. Still now, we encounter many patients with liver disease, especially hepatitis B and C in Asian Pacific region. Moreover, as you know, the liver is expressed as a silent organ. Therefore, it is necessary to actively promote liver disease to the general public through World Hepatitis Day events like today. I would like to express my sincere thanks to SEVAP officials who are doing an excellent job of this task. Thank you.
Pneumonia is highly endemic for viral hepatitis, with a prevalence of 6.5% for hepatitis B and 2.7% for hepatitis C in the general population. Millions of them have silent infection, which left untreated can progress onto liver cirrhosis and liver cancer. Thus, hepatitis can't wait, and they have to be tested, identified, vaccinated, and treated accordingly very quickly. This year, on July 28, World Hepatitis Day, because of the COVID-19 pandemic, Nemawe Liver Foundation will hold a virtual meeting to plan for the prevention and control of viral hepatitis.
Hep cannot wait. This is the motto of World Hepatitis Alliance for the year 2021. On World Hepatitis Day, we will have to declare that Hep cannot wait and prevent a large number of deaths due to hepatitis B and C virus infection, prevent cirrhosis liver, and prevent carcinoma of the liver. This is our motto, and we will have to eradicate it by 2030. Thank you.
Hello everyone. I'm just about to go to do a transplant on a patient who's got a liver cancer secondary to hepatitis B. Why? He forgot to have his vaccine. It's such a simple thing that we can avoid hepatitis by vaccination. So be aware, get tested, get vaccinated, because Hep can't wait. Thank you.
Hello everybody, myself SM Safdar Ashraf, Professor of Preventive and Social Medicine. Please remember 5 points on the occasion of World Hepatitis Day. One is vaccine, second is screening of the blood, third is safe injection practices, fourth is safe sex practices, and finally safe water and food. Stay safe and stay healthy.
Hi everyone, my name is Alex, I am 41 years old, I am from St. Petersburg, Russia. I have been living with hepatitis B and hepatitis C since I was 19 years old. 10 years ago I got cured of Hep C, and this year I found out that I achieved a functional cure of hepatitis B. Hepatitis can't wait, unfortunately for us. Please get tested and start receiving treatment if you need one.
مرضى التهاب الكبد لا يمكن أن ينتظر 2021 صنعاء اليمن.
In Yemen, the viral hepatitis spread in crazy way. For these patients with hepatitis, cannot wait for the diagnosis, cannot wait for the treatment. Expectant mothers cannot wait for hepatitis screening and treatment. The newborn babies cannot wait for both those vaccinations. In our country, in Yemen, especially in these situations, very difficult situations and situations of the world, we need urgent and very urgent helps to diagnosis of the hepatitis B, helps to diagnosis of the hepatitis C, or viral hepatitis in general, and for treatment, than for eliminations of the viral hepatitis in Yemen. Sana. Thank you.
تعرف انه معقول تكون حامل فيروس من دون ما تعرف؟ شو؟ 9 من أصل 10 أشخاص حاملين فيروس الهيباتيتس بي أو سي ما بيكون معهم خبر. ليش؟ لأن ما له عوارض. طب وكيف بعرف إني حامله؟ بتروح تعمل فحص، كيف بيلقطوا الواحد؟ أكثر طرق شائعة هي مشاركة الأدوات الحادة مثل الإبر أو العلاقات الجنسية غير المحمية، يعني استعمل كوندوم. هيك. طب وهالفيروس إنه خطير يعني؟ يس، لأنه من تحت لتحت بسبب التهاب الكبد، بعدين بيؤدي لتليف الكبد أو سرطان الكبد. بثينك لازم أروح أعمل تيست.
Hello my dear friends, my name is Milan Mishkovic from Hepat Center Bitola. It is my pleasure today to announce World Hepatitis Day in my country and to announce our programming and activities. I must say to you that we have for the first time integrated testing for hepatitis, HIV and COVID-19. We have excellent challenge now to have possibility where we can eliminate hepatitis, reduce liver cancer, and in the same time to stop COVID-19. It is my pleasure this time that we have it, so many supporters and so many people who join us and support World Hepatitis Day.
It's the World Hepatitis Day, and for me as a patient with hepatitis B, it's important to know that my government will ensure that I will have access to free treatment and care in the future. And for those around me, that they will have access to screening, prevention and harm reduction programs. We need our governments to act now.
Hello, I'm Anna, and I represent Croatian Society for Liver Diseases Hepatos, which is proud to join activities marking the jubilee of 10th World Hepatitis Day. Carrying out national campaign Hepatitis ne može čekati, Hepatitis Can't Wait, with the support of Ministry of Health and Croatian Institute of Public Health, throughout the entire month we have been offering our services and services of our medical mobile unit in order to remind general public and all stakeholders to stay on a path to eliminate viral hepatitis, even during COVID-19 pandemic, as continuation of testing, treatment and care services is necessary to avoid stepping backwards and losing hard-won momentum in the elimination of viral hepatitis.
My name is Mwapech Sonde. I'm the founder and executive director of HEP Initiative Zambia. In commemorating World Hepatitis Day under the theme HEP Can't Wait, HEP Initiative Zambia has embarked on a grassroots sensitization program that is aimed at raising awareness about viral hepatitis, its diagnosis, treatment and prevention. We also aim at addressing barriers to elimination in Zambia. Thank you.
My name is George Kalamitsis and I'm a co-chair of Achieve and a former hepatitis C patient. The COVID pandemic has disrupted hepatitis C services for thousands of Europeans, including children, vulnerable population groups and chronic patients. We must not lose sight of WHO goal to eliminate viral hepatitis B and C, a public health threat by 2030. We have effective vaccines for hepatitis B and a cure for hepatitis C, so virus elimination is and remains a feasible goal. The EU must help restart the engine and put us back on the road towards elimination, ensuring health coverage for all.
HEP Can't Wait. At we are preventing mother-to-child transmission of viral hepatitis.
We have screened over hundreds of women as well as pregnant women.
It's time to prevent the viral hepatitis in our world today. The time to act is now.
HEP Can't Wait.
HEP Can't Wait.
At Liver Initiative, we are determined to find missing millions living with viral hepatitis and link them with care. The time to act is now. HEP Can't Wait.
Hi, I am Dr. Anthony Garba, the Executive Director of Hope for Healthy Life Foundation. This year's 2021 World Hepatitis Day is around the corner. In Hope for Healthy Life Foundation, we have scaled up our activities. We have scaled up creation of awareness in the society. We We have done this by going around to make advocacy visit to our partners, to government agencies. We have also identified a community to make the day very more impactful and make it closer to the people. We have identified a community where we will scale up our screening and testing of the populace. We are targeting 500 to 1,000 people to be screened, to be tested. We have procured vaccination drugs so that we will vaccinate the same people. We will also give them vaccination, those who we screen and they are negative, against prevention. And we are also going to be offering treatment on this day. We will also give health talk on viral hepatitis B and C, and we are also going to be distributing some items, especially the preventive items, at least condoms to those who deserve it, so as a means of also preventing viral hepatitis B and C. Hepatitis can't wait in my community here, because especially the state where I come from, in part of Nigeria, is the most endemic state with viral hepatitis B especially, and followed by C. So it is time for joint action, it's time to scale up action, step up action, time for proper collaboration, advocacy to all relevant agencies within and outside of our state, everyone that is involved. This is the time for us to harmonize our activities together. And this is why hepatitis can't wait in my community. We have to take down to the root to accelerate action now. Hepatitis can't wait.
Je m'appelle Iman, j'ai 13 ans, je viens du Burkina Faso. À l'occasion de la journée mondiale contre l'hépatite, dont le thème est « L'hépatite ne peut pas attendre », c'est urgent que les femmes enceintes soient dépistées et traitées contre l'hépatite. C'est urgent que les nouveau-nés reçoivent la première dose de vaccin contre l'hépatite 24 heures après leur naissance. Nous venons un avenir meilleur sans hépatite. Je vous remercie.
Hi, my name is Dragiša Zekic. I am from Serbia and I am Executive Director of Hepatitis Hilfe, Port Hepatitis Alliance member. I was living 30 years with hepatitis C infection. I am cured 6 years ago. In Serbia we have 100,000 people with hepatitis C without treatment. No treatment in Serbia. Help us, help us, help us.
To convey the urgency of effort needed to eliminate hepatitis, first we ask, what is hepatitis? It is a viral infection that causes inflammation of the liver. Hepatitis B and C are the most prevalent. Elimination process are vaccination for HPV, therapy for HCV, safe drug and blood injection, routine HPV and HCV testing and treatment. We all at Akaji Kokoma Foundation says, get tested, get help, hepatitis can't wait.
Chairperson Omo, Medical Hepatitis Alliance. On order of this day, we are planning to create awareness and screen our community member. Hep Can't Wait means we have to take action. We have taken action to request the government so that the Minister of Health can regulate the cost of screening and vaccine to all hospitals that operate. And through that, we can achieve the elimination of hepatitis, whereby the community are aware of hepatitis so that we can.
Today is World Hepatitis Day. About 400 million people are infected by the hepatitis B and C viruses, with disparities between regions and highest infections occurring in low and middle income countries. Chronic and acute infections by HCV and HBV can lead to liver cirrhosis and cancer, accounting for 1.3 million deaths per year. But a lot can be done to reduce liver cancer cases through hygiene standards, blood screening and vaccination. There has also been progress thanks to the implementation of vaccination programs and development of effective treatment. We must ensure that these vaccination and treatment efforts continue despite the COVID pandemic as a public health priority. UICC is committed to eliminate viral hepatitis and stands together with the World Hepatitis Alliance and people affected around the world.
Today, we recognize World Hepatitis Day. Our theme is Hepatitis Can't Wait, because the clock is ticking on our global goal to eliminate viral hepatitis as a public health threat by 2030. We have made real progress in some countries on preventing and treating viral hepatitis and expanding infant vaccination. But globally, access to prevention, testing, and treatment services for viral hepatitis remains far too low. Over 350 million people have chronic viral hepatitis. An estimated 80% of them can't access the care they need. As a result, over 3,000 people die every day from liver cirrhosis and liver cancer. WHO's global hepatitis strategy aims to reduce new hepatitis B and C infections by 90% and deaths by 65% between 2016 and 2030. We have the tools to reach these targets, but only if all countries commit to making sure all people have access to them. Let's get to work, because hepatitis can't wait.
Hello, my name is Kyan and I work for Metro Charity as part of Young Greenwich Sexual Health. This year, we're supporting the Hep Can't Wait campaign. Head to the Greenwich Sexual Health website for more information on how you can get tested.
My name is Luís Mendão. I'm a Portuguese person and I'm also co-chair of Achieve. And again, I am an hepatitis C and HIV patient. This year, World Hepatitis Day is also a reminder that hepatitis have not disappeared during the pandemic. On the contrary, they remain a major public health threat in Europe. In fact, the vast majority of those infected still remain undiagnosed. We must prevent suffering and death whenever we can. That's why we call on the European Union policymakers to put forward policies to drive vaccination against hepatitis B amongst children and all the adults that are at risk, and to put in place measures to find the missing millions and link them to care and treatment. This way, all those infected will know their status, can prevent transmission, and have access to effective and affordable treatment that prevents new transmissions. We need that the European Union is a force for good and fight hepatitis both internally in the EU 27, but also in its neighboring countries and globally, integrating viral hepatitis into health and development policies, as we did commit as Europeans when we did subscribe to Sustainable Development Goals.
Hello, we're from Gosh, based in the Midwest of Ireland, and we're here to mark World Hepatitis Day.
There is a simple cure for hepatitis C.
1 tablet a day for 8 or 12 weeks.
This treatment is so effective.
We could eliminate Hep C by 2030.
In Ireland, this treatment is free.
So today, on World Hepatitis Day,
we join with others from around the globe
in providing rapid Hep C tests to help eliminate Hep C completely.
Hep can't wait.
Yeah, so greetings from Live Well Initiative, LWI in Nigeria, and the Women in Hepatitis Africa. We have both organizations are members of the World Hepatitis Alliance. It's been a privilege being part of the World Hepatitis Alliance community, and we started marking the World Hepatitis Day from the very first day that it was declared in July 2011. And this year, we do plan to mark it in a very elaborate way by joining hands with the federal government of Nigeria, the Federal Ministry of Health. So Live Well Initiative is going to speak as the CSO voice, the civil society voice, to speak on viral hepatitis. And the theme is Hepatitis Can't Wait. As you can see in my background here, hepatitis can't wait. We were waiting till 2030 to eliminate viral hepatitis, but we can't wait anymore because there are millions, over 3 million people all over the world living with viral hepatitis are not even aware of their status. And so if you look at the background here, you see that's the Women in Hepatitis Africa, and that's the Live Well Initiative. We are joining forces with the World Hepatitis Alliance and with the federal government of Nigeria to say that hepatitis can't wait. We just can't wait. I'm looking at my time, and time waits for no one. So hepatitis can't wait. Now, to make this work, we're going to talk about what the civil society organizations are doing. In particular, we intend to put a lot of emphasis on the prevention of mother-to-child transmission of viral hepatitis, which is the baby program of the the African Board of Viral Hepatitis, and it is also the baby of the World Hepatitis Alliance. I was privileged to have been one of the No Hep moms. I had the privilege of speaking along with Dr. Suwand, our global president, and then Dr. Fumileshi, who is the global head of viral hepatitis test in the World Health Organization, WHO, and one or two very key patient voices. So it's been a privilege working in the hepatitis space, and Live Well Initiative is proud to be counted among those who can't wait. We can't wait. Live Well Initiative cannot wait. We can't wait. And Women in Hepatitis Africa can't wait. We can't wait. We want viral hepatitis to be eliminated globally well before the year 2030. We want patients to have access to treatment, to drugs. We want the people out there to have access to diagnostics, to screening. We want communities to have access to rapid diagnostic testing kits. We want newborn babies to have unimpeded access to birth dose vaccination. We want everybody to be able to smile because we are saying that hep can't wait. Thank you.
This World Hepatitis Day, Chagro Care Trust and CFID NGOs patient groups will be providing free testing at the community and hospitals where we operate in Taraba, Adamawa, Benue, Bauchi, and Gombe states. Hepatitis can't wait. 90 million Nigerians are living with hepatitis, but less than 5% have been diagnosed. People that need treatment for hepatitis B or cure for hepatitis C. That is why hepatitis can't wait in Nigeria.
Hello, my name is Peter Yahweh from Healthy Liver Care Initiative, Nigeria. On World Hepatitis Day, we'll be leveraging a community-based medical outreach, radio and television program to provide awareness, screening and vaccination services for hepatitis, as well as linkage to medical care. Hepatitis can't wait to be eliminated here because it has taken a lot of lives, both the young and the old, and prevented lots of potentials from developing maximally. Thank you.
For 35 years, I have been working to fight viral hepatitis, especially hepatitis B and C. Eliminating viral hepatitis remains top priority for ISL Policy and Public Health Committee, of which I am the chair. ISIL believes in the value of inclusive work to fight viral hepatitis. By inclusive, we mean working with committed parties and partners, with healthcare professionals, patient groups, and policymakers. To make the elimination of viral hepatitis a reality, we must persist. Persist in improving people's access to screening, in linking them to care and treatment, and in getting hepatitis services delivered at community level. We must cater for vulnerable populations, no less during the challenging times of the COVID-19 pandemic. Community organizations cannot wait for a greater investment in viral hepatitis. They need it now. To this end, in February 2022, ISIL is holding a special event on viral hepatitis elimination in Brussels. There, we will catalyze open discussion with all partners to assess advancements made in science and in public health, and to identify the strategic improvements needed to make the goal of hepatitis elimination a reality.
We cannot wait to act on viral hepatitis. People living with viral hepatitis unaware cannot wait for testing. People living with hepatitis cannot wait for life-saving treatments. Expectant mothers cannot wait for hepatitis screening and treatments. Newborn babies cannot wait for birth dose vaccination. People affected by hepatitis cannot wait to end stigma and discrimination. The scientific community cannot wait for greater investments. Patient organizations cannot wait to be considered crucial in hepatitis elimination. Decision makers cannot wait, and they must act now to make hepatitis elimination a reality through political will and funding. This is a call to action to all organizations, medical doctors, researchers, politicians, and all involved stakeholders to work together, because together we are stronger.
For World Hepatitis Day 2021, the Hep C Partnership are celebrating the message of the WHA Hep Can't Wait through a series of promotional posters placed across 4 cities in Ireland. As well as this, we are also launching a promotional video which highlights the lived experiences of those with hepatitis C. For us here at the Partnership, Hep can't wait because testing and treatment for hepatitis C has largely declined due to the COVID-19 pandemic. We must ensure that we target vulnerable people to ensure we meet the 2030 elimination targets.
Hi, I'm Dr. Koulibaly Alioune Badra. I'm Malian. In 2010, World Health Organization launched the World Hepatitis Day on July 28th. This year, the theme is Hepatitis Can't Wait, with regional theme of Mother and Babies Can't Wait. Hepatitis can't wait. Mothers can't wait. Babies can't wait any longer. With a strong and united voice, we will eliminate hepatitis in Africa by 2030. So help us God. Thank you very much.
My name is Manan Gazawi, founder of No Hep Foundation Sierra Leone. This year, in commemoration of World Hepatitis Day 2021, we will be training 314 healthcare workers at 10 community health centers and screen 745 pregnant females. Pregnant females known to be infected with hepatitis B virus will be linked to the right care, and babies born from those infected mothers will make sure that we vaccinate them within 12 to 24 hours. The elimination of viral hepatitis will be the greatest achievement of my foundation, hence part of the Sustainable Development Goals achievement as well.
An estimated 18 million Nigerians are living with viral hepatitis.
Some states like Nasarawa states have high prevalence rates.
Accelerate access to HCV preventive treatments.
Preliminary efforts led to a 35% reduction in cost to cure.
The transformational impact is seen in Nasarawa state, where the government is committed to exceeding.
In the same spirit to call for increased government and donor investment
towards HCV elimination.
It takes less than 30 seconds
for policymakers to make a decision.
Hepatitis can't wait to get the required support.
Happy World Hepatitis Day from New Jersey. Hep can't wait.
Please join us on World Hepatitis Day because Hep can't wait. Over 1 million people die each year of hepatitis B and C, but with current treatments and vaccines, no one should have to die. We can eliminate hepatitis by 2030 if we act now. Please join us because Hep can't wait.
La Asociación Norte Santanderiana de Hepatitis Virales continúa trabajando para identificar casos nuevos de hepatitis en Colombia. Es mucho lo que se puede hacer, prevenir, diagnosticar y tratar. Colombia comprometida en la eliminación de las hepatitis virales al 2030.
Las hepatitis virales siguen siendo una enfermedad silenciosa.
No esperes más y hazte la prueba.
28 de julio, Día Mundial de las Hepatitis Virales.
Desde ALE queremos participar en esta Semana de las Hepatitis Virales y agradecer la invitación de la World Hepatitis Alliance para sumarnos a su iniciativa con este video. Queremos contarles que desde el Grupo de Interés de Hepatitis Virales hemos estado trabajando el año pasado en toda una actividad sobre el compromiso de COVID y en el hígado. Estamos actualmente trabajando en un proyecto que se llama STAT-C, de revinculación de pacientes con hepatitis C al tratamiento, y estamos iniciando una nueva actividad acerca de microeliminación de la hepatitis C en las unidades de diálisis en toda Latinoamérica. También desde ALE estamos participando en la Global Hepatitis Elimination Task Force, junto con el doctor Marcelo Silva y el doctor Mario Pessoa. Trataremos a lo largo de este año de reenfocarnos luego de esta pandemia en el tratamiento de las hepatitis virales, que es el foco de nuestro grupo y de nuestra actividad.
There are nearly 300 million people in the world living with chronic hepatitis B.
Hep can't wait.
Este Día Mundial de la Hepatitis 2021, las personas con hepatitis no pueden esperar para hacerse una prueba y recibir tratamiento oportuno. Para conjunto con el Ministerio de Salud Pública y Asistencia Social y en el sistema penitenciario, la semana del 26 al 30 de julio estaremos realizando pruebas de hepatitis B y C a personas privadas de libertad. Todas las personas que tengan pruebas reactivas serán vinculadas a la atención para diagnóstico y tratamiento, ya que ahora en nuestro país el tratamiento para hepatitis B y C es gratuito para todos los que lo necesiten.
También impartiremos 2 conferencias, una a médicos de Centroamérica y el Caribe y otra a estudiantes de medicina.
Mi nombre es Rubén Cantelmi, soy el presidente de la Asociación Civil Buena Vida en Argentina, que brinda apoyo a pacientes con enfermedades hepáticas. Soy paciente curado de hepatitis C después de 35 años de convivencia con el virus. El lema de nuestra organización es detectar, tratar y curar. Tener un virus hepático es como vivir con una bomba de tiempo dentro del cuerpo que uno nunca sabe cuándo va a estallar. Trabajemos para erradicar las hepatitis virales.
Welcome to San Francisco, where our Hep C task force does advocacy and outreach to eliminate hepatitis C.
25% of people with HIV also have hepatitis C. Hep C progresses faster for those with HIV.
Because of advocacy, California has dedicated ongoing funding for hepatitis C in its budget for the first time.
Hep C kills vulnerable people. We need to physically meet people where they're at and treat on the street and in needle exchange syringe access programs.
California now requires all methadone clinics to offer Hep C and HIV testing.
I got tested, treated, and cured, and now through community outreach, I can do the same for others.
For patients with cirrhosis who clear Hep C,
You need screening to find liver cancer early. That's what saved my life.
Healthcare providers like myself can do our part by testing, treating, or linkage to care, whatever our capacity.
NTEP CSF is a collaboration of over 35 organizations working together to establish NoHep in San Francisco.
San Francisco Hep C Task Force says,
Don't go viral.
Get tested.
Get cured.
Every 30 seconds.
Every 30 seconds.
Kada 30 segundo ado timaawan kapag hepatitis.
We
lose someone
to hepatitis. This is a call for help
To stop this horrible disease once and for all.
Viral hepatitis elimination
Means giving someone a chance
To take control over their life.
once again.
raise awareness,
Get tested. And support others.
because hepatitis
Because hepatitis
Ay hindi makakapaghintay.
can't wait.
Greetings from the Medicines Patent Pool on World Hepatitis Day. Recently, there's been a lot of progress against viral hepatitis, but globally, we're still not doing nearly enough. We just don't seem to have a sense of urgency. More than 1 million people are dying every year, and we just cannot let this continue. Hepatitis can't wait, or indeed more exactly, people with hepatitis can't wait. We need to go out and find the millions and millions of people who are still undiagnosed and offer them the drugs that will stop them dying, and which now, partly as a result of our licenses, are extremely cheap. And we need to do this right now. We need to commit to much more urgency.
On World Hepatitis Day, Coalition Plus calls on the international community to take action against viral hepatitis. At every level, we still need sustainable funding to continue the fight. And responses to viral hepatitis must take into account the needs of the affected communities. It is also essential that all stakeholders acknowledge the skills and the key role of community-based actors. With the support of UNITAID, Coalition Plus and its partners achieved great results in 7 middle-income countries. Visit our virtual exhibition, Destination Elimination, on our website to see how we did it and to find helpful resources. The fight is as urgent as ever. Hepatitis can't wait. Let's mobilize to achieve elimination.
This is Homi Razavi with Center for Disease Analysis. On this World Hepatitis Day, I want to say hepatitis elimination can't wait. There are 1.1 million people dying every year of viral hepatitis, and we have all the tools we need to prevent these deaths and eliminate these deadly infections. 2020 was a difficult year for all of us, but it also proved to be a great year for anyone involved in viral hepatitis elimination. Do you remember when we were told that there are no funding available for hepatitis elimination? Well, COVID-19 showed us that there's always funding available when there is a sense of urgency. Do you remember when we were told that the complexity of hepatitis C diagnostic prevented us from eliminating hepatitis C targets? Well, COVID-19 showed us that when countries are motivated, they will approve simplified diagnostics and provide them free of charge in every community. When it comes to viral hepatitis, don't take no for an answer. Last year, even with a 6-month shutdown, we screened 62,000 people for hepatitis B and C in Uzbekistan. More than half of those people were screened in the last quarter of 2020 as part of a large COVID-19 screening. This year, we're continuing that project, and we will be screening 500,000 people in Uzbekistan. We at CDA don't accept no for an answer,
when it comes to hepatitis elimination, and I ask you to do the same.
Hello, I'm Dr. John Ward, Director of the Coalition for Global Hepatitis Elimination at the Task Force for Global Health in the United States. On the occasion of World Hepatitis Day 2021, it's my privilege to announce the Coalition, together with local partners in 30 countries, begins development of National Hepatitis Elimination Profiles, or NHEPs. These NHEPs will report on the progress to date toward hepatitis elimination goals in these countries and reveal the strengths and limitations of national hepatitis elimination plans, policies, and programs for the equitable delivery of hepatitis prevention care and treatment services. With this information in hand, the Coalition and local partners will advocate for the feasible next steps to keep these countries on the road toward hepatitis elimination. We know hepatitis elimination can't wait. The Coalition and local partners are not waiting for others to act. We urge you not to wait any longer to become involved. Visit globalhep.org to learn more about these profiles and how you can become involved in the global effort to eliminate hepatitis. Thank you.
Liver cancer can't wait.
Newborn babies can't wait.
Indigenous people can't wait.
Migrants and refugees can't wait.
Policymakers can't wait.
Prevention can't wait.
Testing can't wait.
Treatment can't wait.
Hep can't wait.
Throughout my own journey of finding out in college that I have hepatitis B, to pursuing my studies as a physician and then caring for those with hepatitis, and then coming out about my own diagnosis, and then now speaking out on behalf of those living with hepatitis around the world, I continue to be shocked by the lack of action in the fight against hepatitis. There are more than 350 million of us living with hepatitis, and one of us dies every 30 seconds as a consequence of hepatitis. The lack of commitment and financial support from national governments, global donors, development funds, policymakers, research, and healthcare institutions tells us that they have accepted these deaths which could have been avoided. We are being told that our lives aren't worth saving. We can't wait any longer for action, and it's time for change. The opportunity to eliminate a disease as a public health threat is rare, but for viral hepatitis, it is within our reach. With the vaccine and treatments against hepatitis B and the cures against hepatitis C, we can eliminate hepatitis by 2030. But we must work together and ensure that no one is left behind. The 350 million people living with hepatitis can't keep waiting. The 290 million of those who are yet to be diagnosed can't keep waiting to be tested and then linked to care. Those who need treatment can't keep waiting for access to life-saving treatment while their risk of liver cancer increases by the day. People who inject drugs can't wait for effective harm reduction programs. Pregnant women can't wait for testing and treatment. Their babies can't wait for the Hep B birth dose vaccination. We cannot give the next generation an epidemic which we could have prevented. Now is the time for the hepatitis community to speak in one voice and tell the world that hepatitis can't wait. We will no longer accept the excuses that have been given by governments and global funders who are turning a blind eye to the millions of deaths each year and the continued suffering of communities around the world. Hepatitis can't wait. I know that our hepatitis community will rise up and utilize every opportunity to raise awareness on July 28th. Even if the COVID-19 pandemic has hampered plans, I know that the power of the community is in our resilience and our determination to overcome adversity. World Hepatitis Day is our day, that as an amazingly diverse community from all walks of life all over the world, it is our day to tell the world about viral hepatitis. It is our day to tell the world that it is time to care about us, people living with and affected by viral hepatitis. We could be your family member, your loved one, your children, or we could be you yourself, and it is time to act. And as we reflect on the millions we have lost to hepatitis, we cannot let their deaths be in vain. This World Hepatitis Day 2021 must be a catalyst for global action. We need to grow the momentum and we must eliminate hepatitis by 2030. Thank you again for your commitment, and I wish you all a highly successful World Hepatitis Day.